Hi there, and welcome to Canceling COVID. I'm Tanya Rivens, joining you on this Tuesday. So glad to have you tune in as we continue to bring you information. We still have a pandemic happening, folks, and of course, Dr. Black has educated on us to where it is an endemic, similar to what happens when we get the flu, where there's timing and planning, and you have a great idea of what to expect. I had put this up for you as an opportunity to find out kind of where we're going today. And this is this variant that is happening, as well as the fact that a large city is reinstating a mask mandate. And I think it's important that we acknowledge that we still have some stuff going on around us, people. And I tell you, my friends, it's happening, and we just need to be aware, informed, involved. And I can't do this alone. So I've got a lot of information that I want to share, but that's what we're about, is providing information. So we're seeing some signs of COVID-19 rising again. And I know we're trying to move on, and we're trying to get ready for vacation, which is exciting for so many. Um, but we got to pause and just pay attention to what's happening around us. And it's happening again. There's a surge looking at what's happening in Germany, record high numbers between 250,000 and 300,000 new infections a day in the last week. Also, the UK and France, the Netherlands, and Austria, they have some rising cases also. And it's interesting, as in doing the research, that the rise in their countries, it's being driven by different factors, like, of course, the lifting of COVID restrictions. But we're going to talk more with Dr. Black too about immunity, from these vaccines and the booster shots, and if they're working. And then there's some other transmissible Omicron variants that are out there, subvariants. And I don't think we're talking enough about these. And perhaps we are. We just gotten so sick and tired of dealing with it. It's like, okay, come on already. But looks like, from the standpoint of the governors, and especially from the leadership from the CDC, let me say it like that, in the White House, they're counting on the booster shots and the treatments that we've had, for the moment, to kind of even or balance everything out. And that's why the whole mask mandate thing apparently not necessary in their eyes, or for now. And also to the point where everybody's pretty much had at least some variant of it. Maybe that's the whole idea. I see you guys hopping on. Let me first of all say thank you for joining us. Thanks for hopping on. Leave your comments in the box in chat, and we'll talk more about that. But some interesting things starting to develop. And I guess what's most disappointing is maybe we're getting way too comfortable and not paying a whole lot of attention to it. And we've done this so many times already. Like, we know it's happening, we know it's coming, but instead of being proactive, we're always reacting. And maybe I just don't know that the experts are doing their part. And from where I sit, little old me, just not on top of things. But I know somebody who is, and that's none other than Dr. Trasha Black of Groundwater Solutions, who I always love bringing on board with me because she knows what she's talking about. And she certainly helps me to educate you all and get you the information that we need. So good morning, sis. Thank you for tuning in.
Good
And
morning.
as always, hey, it's always great to see you. But what's happening here? I mean, here we are. We're seeing it again.
Mm-hmm. But Tanya, we're like this, and you're frozen for me. I don't know if I'm frozen. Hello. I don't see anything. I'm going to keep talking. So in case the audience, if you're here and you can hear me, I'm frustrated.
There we go.
Okay.
I don't know. Look, maybe the little internet guys decided to interrupt us for a moment, but thank you to everybody for hanging in there.
Yeah.
We've never had this happen on.
Never. And I was just going to start talking, keep talking, because I didn't know if they were listening.
Well, I'm glad to have you back here. So we see what's happening around us again.
But I don't think they see, Tanya. I think we're like this. I think we don't want to acknowledge what's happening.
How is that possible? I mean, well, I guess it is when you're just sick and tired of
when
being
you're sick and tired and you don't want to deal with it and you don't want to go back.
Right.
That's really, we are a society that does not like to look at the past to inform us of the future.
Oh,
And
come on now. That's a whole
that's on a
sermon
lot
right
of
there.
different levels. So yeah, that's a whole different discussion.
Oh,
Um,
critical race theory, but that's a whole nother.
that's a
Okay,
whole
go ahead.
nother
All
issue.
right.
Yeah. But before COVID-19 really hit the United States, it hit in the other countries.
Right, right.
We saw it happening. We
Uh-huh.
knew it was coming. And I
Yes.
don't know if they think that we as a country are immune to anything. I don't know. But we see it over there now in
Mm-hmm.
other countries. We see it traveling around the world. Those are also communities that have gotten the vaccine, that
Right,
have
right,
folks who
right.
are double vaccinated and boosted, and
Uh-huh.
they are still seeing a spread. So why would we think that that's not going to happen here? Why would we not be proactive and take the necessary steps?
And I don't understand.
Unless we're this.
Okay. Well, but we've got experts. I mean, we've got plenty of experts like you and others that
Mhm,
in tune and talking and having this conversation. And yet, and still, it's still, we just saw the high profile string of cases, even that have broken out in
mhm. In
Washington.
the government,
Yeah. Yeah. So you don't think even there that no one's saying, hey, we can't rush this thing back to life as the new norm?
I think they should. I was hoping after that spreader event that
Mhm.
there would be some dialogue about it, but we have not yet seen that happen. I was at a political event here in North Carolina last night, and I
Okay.
was the only one with my mask. And I'm gonna be honest, I didn't put it on.
Uh-huh.
I had it on my arm. I wear it on my arm. And but then when nobody else, and typically like I go in the grocery, I have my mask on my arm all the time wherever I go. And when I go in a public setting, I will typically put it on.
Uh-huh.
But I was there representing, and I felt the pressure
Yeah,
not
a little
to put it on.
pressure. Yeah.
Yeah, right. And why should I feel pressure if I choose to wear a mask to
Yeah.
protect myself? And so I can understand for people who are not aware or who don't want to be the outsider. Typically, I will still put it on, and I'm not ashamed to say I didn't, but I didn't put it on last night.
And
But we,
that's okay. Yeah, it happens. Now, typically in church, most churches are still requiring it, which is great. But
Mhm,
funny you said that. I was at the nail salon yesterday, and a young girl, they're in spring break, and she came in, and everybody had a mask on. And I do support wearing it in the nail salon as
mhm.
well with all those chemicals. But
Yes.
she looked around and she goes, what's wrong? Am I supposed to have a mask on? Because she was the only one. And I just got tickled. It was really funny because she wasn't required to have
Mhm,
one. It's not
right.
required, but it
Mhm,
is suggested. And in there, I think it's a great idea. But we've all been there where you kind of feel a
mhm,
little bit of pressure. If nobody else
mhm,
has one on, then should I put mine on or should I
mhm,
not? But speaking of masks, I see Philadelphia, they
mhm,
are getting ready to bring the mask mandate back for
mhm,
indoors at restaurants, shops, offices,
mhm.
public spaces, and it goes into effect April 18th. So they're not playing.
Right.
My
Mhm,
brotherly love, they're saying,
mhm,
"Hey, we are going to do this," and
mhm. Whether it's popular or not, we're still
right,
going to do it. And I think that needs to be the folks who are aware and awoke. That
uh-huh.
needs to be our mentality, that whether it's popular or not, we will do what's safe and what's best for our community.
So in our community, let's bring it back home to Charlotte. What are you seeing? What are you hearing? Like you were at an event last night, no
Mhm.
mask. It feels great not to have to wear them.
It
I'll be honest
does.
with you. Yeah,
Mhm. I
it
breathe
feels great.
better. I'm more comfortable. It is not a comfortable thing. I acknowledge that.
Uh-huh.
And I was saying last night, I said, you know what? I said, I'm not going to be shocked when after this event, we find out someone's had COVID. And so I was just acknowledging, I guess me, when I didn't wear it, I'm taking my own risk that I may
Yeah.
be one of the ones that walk away with it from this with the virus. And so I made the decision last night. I'm just not going to do that. Popular or not popular, I don't want to be sick with COVID. We are seeing folks here in Charlotte, Mecklenburg, in North Carolina,
Uh-huh.
with COVID again. The numbers
Again.
are going up. We went through a period where we would have zero positives every day.
Mhm.
I think I told you that. It's
Yeah.
been weeks since we had seen a positive. Well, now the positives are back.
Wow.
They're not in like astronomical numbers, but
Mhm.
we are definitely daily seeing positive folks again. So that means that the virus is out there. Tanya, the mask, although most people say, well, it really doesn't work to, keep everybody from getting COVID. No, but it does slow the spread.
Yeah.
It's preventative efforts with any illness and disease. We want to slow the spread. We want to slow the progression. And we know for a fact that the masks do that. So
Right.
why not, if we know the risk is there and it's
Uh-huh.
out there, slow the spread.
Oh,
Bring,
Lord.
wear masks.
And we got Easter coming up this weekend, Resurrection weekend. Everybody out on spring break, big gatherings on Saturday, Sunday, and don't forget about Easter Monday. Oh my
Right.
goodness. We're getting ready to set ourselves up for quite a weekend.
Yeah, and we're going to have a lot of folks again out sick. We're going to have folks in the hospital, and then we're going to look back and say we should have done something more. So I say to the community members, don't wait for the mandate. I do believe mandates are going to come back. We're going to see cities and states re-implementing them,
Are you
and
really?
I do.
Oh wow.
And maybe with some type of revised things, but they're going to have to. I mean, in the other countries, they're bringing back. Some are bringing back mass mandates. I think it's the wise thing to do.
Well, here's the thing though. We're coming up on warmer weather. And so when you're outside, outdoors, I get it. Apparently, when you say with some more restrictions, which we kind of started heading in that direction,
Mhm,
not so much outdoors, but when you're inside with large gatherings,
mhm,
you see in the future the
mhm.
mask mandates coming back.
I do.
So what kind of COVID? What are they catching now? What are we catching? Because we got the vaccine, the booster, and then some people boosted again. So
Mhm.
this is the subvariant of Omicron? Omicron?
It is. Well, we don't know, because the original variants are
I'm
still
sorry.
out there as
I was
well.
getting ready to say, "Oh, Marion," because everybody was just
We are funny people, aren't
I
we?
know it. Go ahead.
Yeah. So the other variants are all out there. So when we think about Omicron, the Delta is still out there. The original COVID-19 variants are out there, and we don't know. So a lot of our patients, especially during Omicron, would call us and say, "Hey, can you tell me if I have the Omicron variant?" Well, no, at the community level, the general laboratories do not test for the variants. The
Okay.
state laboratory takes samples, they take a random sample and they test at the state level to see what variants exist in the state. So, so I at the community level can't say what are the variants that I'm seeing in my lab. None
Okay.
of us can. But this North Carolina can tell us what variants are being found here from the random sample of positives that they pull.
Okay.
Yeah.
So I'm kind of surprised. I don't know why I thought that once one variant or what one strain was out there, like the Delta, once it runs its course, it's gone, and then we see another subvariant. They never leave. They just stay
Just
stick
stay.
around.
Mhm.
Yeah. But once you've had it or boosted, or let me say the science supposedly shows that these vaccinations that we've gotten protects us or helps us deal with it to where it's not
It
dead.
reduces the risk.
Okay,
Exactly. It reduces the risk of dying from the disease. And there is a small amount of protection from contracting the disease.
okay,
So
okay.
it does reduce that as well. And then we've got to do our part, so that it's
Mhm.
only gonna the earned immunity. You earn some antibodies and immunity from having carried the virus before. You earn some immunity from getting the vaccines, and then we've got to do our part, because if it's out there, just like the Omicron, I told you, if you were in the room with it, you were
Uh-huh.
probably going to have it.
Yeah,
So unless you took extra protection, hazmat suits, all of that. But
right.
we know that there are things that protect us from contracting it. Masking is one of them. Social distancing. Remember those things? We don't even talk about that anymore. Or,
No.
or spatial distancing. We've got to return to doing those things, because now we know that another version, the existing versions are out, which
Mhm.
hopefully we have built up immunity to. But there are new versions out as well. But even if you've got immunity, there are still chances that you get it. So you just do your part to reduce your risk.
Well, maybe we're just all kind of in a fog because you just said that about the physical distancing. So I was
Running
out
a
at
business comes with pressure. Fortunately,
I don't know
there's
where that's coming
Insperity. With
from.
Insperity, nothing seems impossible.
I was there
Joan, I think
yesterday, and forgive me, that is me.
Mhm.
Something I had up on my computer. All kinds of things happening today. Anyway, I was out yesterday. Oh, not yesterday. It was Sunday. I was at a food establishment, and there was a gentleman. I was trying to do the physical distance of 6 feet, And every time I move, he moved closer. And so I finally just kind of stepped out of line and stood out of the way. And I kind of looked at him and I said, yeah, I was just kind of trying to keep some distance between us because, we're still in the pandemic. He goes, you're so right. You're so right. I've had it 2 times. It was so bad. One time I couldn't even walk. And I'm going, but sir, you're not even trying still to be cautious. And so I just think that we still are just so misinformed and just, I don't get it. I just,
We've let our guard down, and
yeah,
it feels good to be out there in
yeah.
a room full of people again, and concerts and things like that. So it's hard to, and I don't think it's going back. I think it's incorporating a new way of us being. So yes, let's do the concerts, let's do those things, but keep in mind for every event, if you're planning an event, you're hosting an event, you have a responsibility. And COVID-19 protection is one of those responsibilities. We're excited. We're working with a church who's doing a 1-week retreat.
Oh,
And
right.
they have asked us to come in from day one. One, they're asking folks to be tested before they come.
Uh-huh.
2, they're asking us there on day 1 to provide rapids and the PCR test, and for that to happen multiple times before the end of the event, and for us to remain that as people are departing, and if they want to be tested to ensure that they're going home virus free, that we make that available, and we're going to do that for them. So I am so excited about the level of responsibility that these organizers are having. And so if you're on a restaurant or whatever you're doing, just keep in mind that when we invite people into our space, we invite them to participate in our programs, that gives us a higher level of responsibility that we're going to have to make sure that we take seriously, because the general public is not anymore, because they have received the message that it's over and that they're good. And we know that's not true.
Absolutely. So perhaps that would be a great trend. And we talked about this before. Maybe it will pick up this time where people, as they are hosting events or are like with the church or retreat, have someone such as yourself have these type of companies on site to do testing. I know when we went to an event earlier this year, or was it late last year? I believe I mentioned to you, and they hired someone to be on site. It was a concert, but I haven't seen any of that or heard any of that happening this year because we've gotten so comfortable. So we could talk on and on and on. For anybody that's on, we welcome your comments in the chat, but also share this so people do at least know that somebody is talking about it. We do see the numbers, and I do see the news rounds where the professionals are mentioning of it, but we're not hearing. I think we could probably hear more about this strain that's already popping off in Europe, and it certainly had it this way. We're not going to be totally immune from it. But what else are you seeing out in the community? You just confirmed now you're starting to see some more positive cases. Are you seeing an uptick in testing again? Because it pretty much died down.
Right. We are not, except for the folks who are feeling sick. Yeah. But the numbers of folks being tested are not high. It's still very low, but it's not non-existent. And we went through a period of time where there was literally no testing at all. But now folks are, what I am seeing though, is I see folks who tell me that they're sick. And it's folks who've had COVID before, and they'll say, well, this time is different, so I don't think it's COVID. And then I encourage them to get tested, and it is COVID. So yeah, so I think even if you've had COVID before, if this feels differently, it does not mean that it is not the virus and that you are not contagious. So I will go back to say, if you feel different, if you have cold or flu-like symptoms, if you have nausea, those are all potential signs of an infection, and just rule it out. Again, I told somebody once, if my elbow hurts, I get tested, because body pain was a part of the infection for me, is strange pains in our bodies. And people of color, Black and brown folks, that is one of the primary complaints of the virus. So that you may not feel anything but an ache in your back, but you might be contagious and carrying COVID-19. So testing is just a preventative measure that I think we all just need to incorporate as a part of what we do. Regular serial testing, I'm going to go back to that, where you have a schedule, and every 2 weeks I'm going to get tested, or once a month. That is just something that you do as part of your own personal wellness and healthcare. And then definitely, if you have a new symptom, illness, something that feels strange, then please go get tested.
So, Dr. Black, do you touch on something early as well? That's your phone. Dr. Black is grabbing her phone while she's doing that. Of course, they are a
Yeah,
sponsor of
somebody else's phone. Yeah.
all right. Groundwater Solutions, groundwater-solutions.org, 704-596-0505, 704-596-0505. Real quick, because again, this has been just a great conversation, and I could tell you're passionate about this because we're trying to educate our community. But one of the things you mentioned that also isn't getting enough conversation, maybe if people realize that if we get back to that danger zone again, then it starts impacting the hospitals. And then we are really headed to a very different and dangerous spot yet again, because then we've got the mental health toll that's taken on our healthcare workers. Our hospitals are full. The mental health or just the impact that will have on you because your loved ones are there and you're not be able to see them. All of this, and I pray we don't get that far gone again. But do you think people think we could ever go back to that?
To that level?
That's correct.
I believe we can. A virus is alive, and it will keep mutating. This is what we know about the viruses, that they will keep mutating to become more and more. They're trying to survive, just like we're going to do whatever we need to do to survive. That's what viruses do. They mutate so that we cannot kill them and stop their advance. And they get smarter and smarter. They are able to be evasive and evade the strategies that we put in place that worked before. So we have to keep getting smarter too. We can't just stop evolving as this virus evolves. So definitely do the things that we've always done. And then we need to keep coming up with, if it evades that, we need to figure something else out. But let's just stop what we've done before that works.
Right. Well, what you got going on? I know you all had the job fair. Hopefully it went over very well. And then any updates that you would like to share?
Yeah, well, the job fair went really well. I think we have had folks who started this past Monday. And then we have another group that's going to start the following Monday. So we are really, really excited. We are revamping we have a part of our organization called community engagement. And so we are revamping that piece, and we're bringing in staff and our community health workers to help us with that. We're getting our mobile units back out, and just like we use the mobile units for COVID-19, we're using that same model to take healthcare out to the community, primary medical care, mental health, behavioral health, addiction services. We're going to be going out into the streets and into the rural communities with those services as well. So we're pretty excited about that. We've got a lot going on. We are expanding our medical services into Gastonia, North Carolina.
Oh, good. Congratulations.
We'll have a practice there. We are in Albemarle, we're in Henderson, North Carolina, and all of their surrounding communities. So we are busy and we're excited.
Well, we are excited for you, and just congratulations as you continue to serve. You have such a heart for our community, and we are very grateful for that. So thank you, thank you, thank you. Again, Groundwater Solutions, groundwater-solutions.org, 704-596-0505. Dr. Black, anything else before I let you go?
Oh, one thing. So if you did miss our employment fair, it is not.
So I don't know if it's my internet service or hers.
I'm frozen again.
Of spinning. There we go. So apparently she dropped off, but what she was getting ready to say, more than likely, they just had the job fair last week, a career fair, an opportunity for you to come out and find out what they're doing and to get involved. You can still reach out to Groundwater Solutions, groundwater-solutions.org, groundwater-solutions.org, 704-596-0505, 704-596-0505. Well, we're going to take advantage of this last opportunity, especially since we had 2 hiccups for a few seconds, to just remind you again to keep your eyes open and beware of what's going on with this latest variant, that subvariant that is starting to impact over in Europe. So it certainly is going to head this way. So when someone says, hey, we're out of the pandemic, said no, that strain is starting to spike again. So just beware and be cautious. And another thing, as someone who works with Atrium Health to help to get the word out, go to atriumhealth.org/about-us. It's about coronavirus COVID safe. They send me a lot of little tidbits and information. One is about some of the places where they are out doing the vaccination and the boosters. And so hop on and see if you think you're interested. Of course, Groundwater Solutions provides it as well, but Atrium Health, they've got some locations out in the community coming up also. Again, it's atriumhealth.org/about-us coronavirus/COVID-safe. Well, my friends, it's time for me to move out of the way. I certainly appreciate you tuning in each and every Tuesday. As always, life's challenges make you better, not bitter. I'm Tanya Rivens. You can join me this Saturday, 10 a.m. on Praise 100.9 FM. Again, Praise 100.9 a.m. Praise 100.9 FM, that is. Getting it at 10 a.m. So Praise 100.9 FM at 10 a.m. is where you can join me for the best in gospel music. I'll be listening for you there as well. Please reach out to me if you have any comments, suggestions. We're going to hang in there, folks, regardless of where we are with this pandemic or endemic, and regardless of how we are starting to adjust to the new norm. There's always great information that we can get out to you, and we think that this is just one of many media outlets that will help to keep you informed and to keep you aware of what's happening. So thanks again for hopping on every Tuesday, 11 a.m. Be alert, be well, be safe, and always check on your neighbor. And most importantly, thanks for tuning in to Canceling COVID, because together we plan to work at doing just that. Enjoy the rest of your day, everyone, and enjoy Resurrection. Well, we're inside of Holy Week, and then enjoy Resurrection Weekend. Thank you for hopping on.